Welcome from the Music City Center, Nashville, Tennessee. We're here at the EMS World Expo, the largest EMS dedicated event in the world. This is EMS World Presents Stories from Expo. Your story continues here.
Hello, we're here in Nashville, EMS World Expo 2018. This is the EMS Garage / EMS World podcast. We're doing kind of a mashup double team this year. I'm Aaron, and this is Lauren. Lauren Young, and you are from Palm Beach County Fire. Is that the...
Palm Beach County Fire Rescue in Palm Beach County, Florida.
Florida? That's
yes.
I would have guessed Florida.
Yes.
Not too...
Palm trees,
palms grow
warm
elsewhere,
weather, yeah. And the best fire rescue in the country. No, I'm just kidding.
Sure, yeah. I mean, I don't have a stake in the game. I work for a private company,
Okay.
so the best one right here.
One of the best ones. There's many.
And do you have a poster board, or are you giving a presentation?
I actually was on a panel this morning talking
Okay.
about the challenges as well as the triumphs of developing mobile integrated health programs and things that we've learned along the way in Palm Beach County. So that was a really exciting opportunity to talk to some innovators and visionaries out there who are also doing mobile integrated health out in the U.S. and internationally. And so it was a really nice opportunity to connect to other people.
And what is your role? I see it says a licensed social worker. Are you also a paramedic or EMT? Or
I am not. I'm a medical social worker.
Okay, cool.
So my area of focus is medical trauma and bereavement, adjustment to disability and illness, and death and dying.
Yeah.
So my coursework is sort of half counseling, half nursing. And I've always worked in acute care and also dabbled in some hospice and home care. And so that really helped prepare me for coming into a new practice area, which is working in EMS as a social worker.
Oh, cool. And so the panel that you were on today, what did you come to a consensus on?
Yeah, I mean, one of the big takeaways I think that people got from the session is that it's okay to start where you are with what you have, and to be adaptable, to be flexible. And I said to a lot of people today after the presentation, who are coming from various levels in terms of resources for their programs, it's okay if your vision can't all come to be right at once. Start where you are with what you have, and build, take baby steps, and eventually, you'll get where you want to go. Sometimes you think where you want to go is in a certain direction, but you learn along the way and you might divert, and that's where that adaptability comes in. So I think in the world of mobile integrated health, that's really critical, is, being willing to start somewhere, being adaptable, and really being able to be innovative.
Okay. And so what is all encompassed in mobile integrated health?
So that means different things to different departments and different people, as I'm sure you know. Some people call it community paramedicine.
Yes.
Mobile integrated health for some is going out into the community and providing grassroots services. For others, it's very organized services that help in addressing some of the challenges that EMS faces, like high frequency utilization, assisting hospitals with readmissions, dealing with chronic disease management, behavioral health, addiction. At Palm Beach County Fire Rescue, it's all of those things. We have a few different service silos, and our program is unique because we do have social work on board. So we're a multidisciplinary program, whereas a lot of programs across the country focus on community paramedicine. We partner social work with community paramedicine so that we're approaching the patient in a more holistic way.
Oh yeah, I mean, I think that makes a lot of sense.
It does. When our chief, Division Chief Richard Ellis, developed the program, he was talking to a lot of folks out around the country, and he would ask them, what is the big gap for you? What are some of the areas that you're struggling with? And across the board, they were saying social services. And so his idea was, well, why don't we just go ahead and bring on that element to our program?
Yeah.
And so I'm very thankful for that vision that he had. I wouldn't be here without it. So, it's something that was unique and innovative, but we're starting to see catch on. And one of the exciting things for me being here, besides talking to you about this, is hearing about all these different departments across the country that are starting to think about bringing social work on or are doing it. I think it really shows this is taking off, this idea of multidisciplinary care, which has been in acute care forever, but is something new to EMS.
Yeah, seeing how long we've been on the front lines, and I can't tell you how many times you say, oh, we got to call a social worker, we got to contact one of this or that, and or you bring them to the hospital and you say, well, they need to talk to a social worker, and then that's it.
That's it.
But the hospital, the nurse didn't see the house. The nurse, we know.
That's true.
And I think if if the patient comes off as somebody who maybe doesn't need it, then they'll say, oh, we'll just send them home. And we have no way of following up.
Right.
Period.
There's a lot of gaps, right?
Yeah.
And if you talk to a lot of people who work in mobile integrated health and are going into the homes of people after the 911 call and are seeing what's going on in the environment, across the board, one of the most common issues is care coordination and a lack of it, a lack of providers talking to each other, the lack of the ability of the patient to advocate for themselves or to even potentially know what they need. And so they have difficulty managing their needs. And what mobile integrated health can do, especially if there's a multidisciplinary element, is bring together that care coordination piece, bring together all the different elements of the healthcare continuum so that people can get the solutions and answers to be able to better manage their care at home. And we know that for a lot of these folks who are high frequency utilizers, it's not that they're having medical emergencies as you or I would define them. They're having crises and emergencies that relate to the inability to have their needs met in a very grassroots level. And so to be able to bring in social services from the beginning and paramedicine, because to me, one without the other really doesn't work in our model. You have to have both. We balance each other. But to be able to provide both sides of that right at the beginning really reduces the risk that that patient's going to need to utilize 911. We can get them to the right level of care much more quickly.
Okay. How long have you been with the fire department?
I have been with Palm Beach County Fire Rescue almost 2 years.
Okay.
So it actually someone was just talking to me about my integration into fire service because obviously that was something new. And so, I have to say that I'm very thankful to Palm Beach County Fire Rescue because they did a phenomenal job of really making me feel part of the family right off the bat. Captain Jessica Banks was the community paramedicine coordinator when I came on board, and she very much took me under her wing and helped, train me and educate me in all things fire service, and really helped the medics begin to trust me because, they weren't quite sure what they were going to do with a social worker. They didn't know what I could do, and they weren't sure, who I was, and it's a tight-knit community. So I'm very thankful at the way Palm Beach County Fire Rescue approached it. I'm a member of the union. They integrated me into the family right away, and I've done ride-alongs, and I went out to stations and talked to medics and got an idea of what they were hoping to get out of these programs, what their concerns were about the programs, and just learned all things fire service. From how to wear the uniform, which is new for someone who's outside of fire service, to making sure that I checked in that everyone got their lunch, because you guys really worry about everyone having eaten since you're used to being at a station and all eating together. So all those little nuances that you as a paramedic or firefighter kind of take for granted because you kind of grew with the system, for someone coming in with 20 plus years experience into that and never had experienced it before, I think integrating the social worker into that culture is really critical to make it work for the program.
So in the 2 years, what kind of an impact have you seen that your position has made?
Well, I think the position has made a tremendous impact, I hope. I don't generally like to talk about myself, but from a global perspective, I know from our statistics that having the social work element is huge. About 70% of our cases have a very heavy social service element to them. So without having a social worker on board, those needs would likely go unmet, or maybe not as effectively met as they could be, or as quickly met as they could be. So just looking at the data in terms of what the social worker brings to the table, both in terms of the program development piece, because we do bring a vision that's a little different than what a paramedic or firefighter might bring to the table. So both in terms of developing the program and understanding the systems approach of care, which is really what we're talking about, treating the whole system of the patient rather than just one specific issue being medical, was really important. And then the other piece of it, of course, is the patient's response. I think that the patient, the way that we approach the patient is very different than a paramedic, and so I think that having a social worker on board is a real relief to a lot of patients. They understand social work. They understand that we're there because we truly care about the patient in ways other than medical.
Yeah.
And I think that helps really build a trust with them that then allows the paramedic to more effectively do their job as well. Because a lot of the patients who have chronic disease management issues are coming with a lot of trauma and anxiety. A lot of them have been told they're non-compliant. A lot of them have been told, that, they're not doing what they're supposed to do to care for themselves. And they hear that over and over. It's reinforced. So they do have trust issues with medical professionals. And so for us to be able to go in as this, non-judgmental team and work together both on the psychosocial side and the medical side, I think makes both sides more effective.
Absolutely. So you're kind of pulling pulling it from the public service model to the healthcare model.
Yeah.
You kind of.
Yeah,
Or-
I think the medical model, kind of looks at a person like they have a problem, let's fix it. So the social work model is a systems approach that there's lots of things going on around a person that are contributing to what their issues are. And so our model kind of mixes those two together,
Cool.
as you're describing. And I do think that's the approach that we need in EMS. I mean, if you really think about it, how often do you go out on scene and it's just one issue, right? Usually there's a lot of things going on for that patient.
Oh yeah.
But you, as a paramedic, can only deal with that one issue. That's, unfortunately, your hands are kind of tied in that respect. And so, whether it be regulatory or protocols. So I know that's a frustration for a lot of medics. They want to do more, and they have the capacity to do more, but they don't have the ability to do more because they've got to clear that scene or transport that patient. And so I think for our medics, one of the big surprises I think of having social work involved is the relief it provides to our crews when they know that behind them is going to be a team of people who are going to be able to follow up with that patient and try to help them in some way. That's a relief to our crews. I would actually love to do a study on mental health of our crews and whether or not it makes a difference for them to know that there's going to be some outcome, some support beyond what they were able to do on scene to help bring some closure for them. Because as you know, run after run on the same patient, you start to develop concern for them, frustration with them. That brings up emotions for our medics. And so, knowing that I'm coming in and our community paramedics are coming in and might be able to help resolve that issue for that patient, I think it's a real relief for them.
Yeah, I could see why that would be.
They like us.
Yeah, absolutely.
Yeah.
Well, if somebody wanted to have to get some more information from you or your department about bringing on clinical source,
That's okay. Yeah, a medical social worker.
A social worker, something like that. Do you have a work email or something like that they can get a hold of you?
Absolutely, yes. They can email me at ldyoung, as in I'll never be old, ldyoung at pbcgov.org.
Okay.
And I would be more than happy. I work with departments across the country. I get calls all the time.
Yep.
Here at EMS World Expo, I actually just finished meeting with a couple of folks who wanted to talk to me a little bit about social work and integrating it into their programs. I have 2 programs coming down next week to shadow with us. So, we're very open at Palm Beach County Fire Rescue to share what we've learned. It hasn't, we haven't had 100% home runs every time. We've learned some lessons along the way. We're going to continue to learn and grow. But we feel that we've built a program model that really works, and we want to share it with everybody because our goal at Palm Beach County Fire Rescue is for people to get help and for people to have the highest life quality possible. It's our honor to serve them, and that's sort of our vision at Palm Beach County Fire Rescue, and we want to share with as many departments as we can that this is possible. And there's lots of different ways to integrate social work, even if you can't hire a social worker in your department. There's lots of steps you can take to integrate social work in your model. And so I love to talk about it because I really do believe that it's the best way for us to approach these types of patients who have these really significant acute issues going on in their life that 911 call can't address.
That's amazing. I actually look forward to seeing what the future of social work and EMS joining together brings for the patients in our communities. So email her if you have any questions about what she does and the Palm Beach County social work EMS. I don't know what you call it. Just mobile integrated healthcare.
Right. It's our mobile integrated health program at Palm Beach County Fire Rescue.
Right. And for more content, I don't know if we have any more additional content on that topic, but we do have many other videos on this channel with great interviews from here at EMS World Expo in Nashville. This is 2018, and you've been listening to the EMS Garage Podcast / EMS World Podcast.